Doctors of Reddit. What is your most distressing diagnosis? Story 1. I have a patient I've seen for 4 years. Really nice guy, couple of minor health issues. His wife has been going through treatments for breast cancer, then brain cancer, since I've met him, and is finally doing well. He came in with unintentional weight loss about 2 months ago, though noted that he actually felt pretty good overall. He had lost about 20 pounds in 2 months without trying. He thought maybe his diabetes was just a bit out of control, as this is how his diabetes had presented initially. We did a workup that took a while, and the bottom line is he ended up finding that he has pancreatic cancer. Had to bring him and his wife in and explain that while she was doing much better, he has likely a very short time to live. You're not supposed to get close to patients or necessarily get attached, but this one was hard to do. When I saw the results of his CT scan initially, I just felt dread and sadness. I just dreaded having to tell them the news. I felt horrible. I just wanted to be able to put it off forever, but obviously it had to be. Story 2. My dad is an ophthalmologist, eye surgeon. He always goes back to the same experience. Retinoblastoma is a cancer that mostly affects children. You can detect it if the usual red eye in flash photos is white in one or both eyes. It can be hereditary. Treatment can be attempted, but if not caught early enough, the only way to try to save the patient is to enucleate, remove the eye. When he was a resident, there was a 5-year-old girl in the hospital. She'd had her left eye enucleated a few weeks prior. In a follow-up scan, they found tumors in her right eye as well, and had determined it needed to be enucleated as well. She came out of that surgery with her head bandaged up. Her parents were by her bedside when the nurse removed the bandages. Once they were off, this 5-year-old girl sat up and just said, "Daddy, I can't see you." Story 3. I grew up in the US, but went to med school in India. A few years ago, during my pediatric rotation internship, I had an 11-year-old patient with worsening seizures and other neurologicals. He was from a rural village and had slipped through cracks of the vaccination program, and as it turned out, he had a history of measles as an infant. We diagnosed him with subacute sclerosing panencephalitis, a progressive and fatal complication of measles with an onset years after the initial infection. It was heartbreaking trying to explain to the parents that their child had months to a year left, and that the cause was something that happened almost a decade ago. Story 4. Neuro or psychologist at a hospital. I get the title DR from having PhD, if that matters. The most emotional conversation I've ever had to have with any patient was with a lovely elderly couple and their daughter. The couple met in school and had been together ever since, had one child, and were both retired comfortably. They were living in a granny flat behind the daughter's house, but were still very independent. They had both been coming in for neurological exams because they had been experiencing some memory loss, and we were keeping track of their progress with various tests. Long story short, I had to tell this couple and their daughter that they were both exhibiting the early signs of dementia and that it was likely going to get worse with time. Thankfully, they still had periods of lucidity, and so we were able to set up some management plans. But the daughter looked like we had just ripped her whole world away. I've never seen someone in so much pain be so strong. She was positive and supportive and reassuring them, but I could see that she just wanted to break down right there. She would come back every few months for counseling. We run a separate clinic too, and I kept seeing her after the couple passed away, and she is doing much better. From having a parent with dementia myself, I could only imagine the pain of having both parents succumb at about the same time. Story 5. I didn't tell the diagnosis to the patient, but diagnosed it yesterday on his CT scan, and it has been weighing heavily on my mind. Patient with stage 1V colon cancer, his colon perforated, an infection from the bacteria in his colon spread to his testicle, and there was likely also infection around his aorta. They took out the colon and the testicle. Amazingly, he was discharged from the hospital, came back a few days ago. Repeat CT showed the infection caused a huge aneurysm dilation of his aorta, and it is leaking blood. So basically, it is going to rupture and he will die almost instantly. Or maybe it slowly leaks out, and death happens more insidiously. I can't imagine being told you have a ticking time bomb inside of you and may have hours, days, or maybe weeks. Story 6. I had a lady follow up with me in the office after being discharged from a different hospital system without a diagnosis as to why she was jaundiced. I knew something bad was brewing, so I ordered a stat MRI of her liver and found a cholangiocarcinoma, tumor of the bile duct, in a location which was incurable. I had her back in the office within 48 hours and told her the news as gently as I could. She just said, "This must be really hard for you." I just lost it and started crying immediately. I couldn't believe she thought of me at that moment. We hugged and cried for a while, and she was very appreciative. Story 7. Doctor now, this happened when I was a neurosurgery extern in LA. I was in surgery and got a page from our other hospital that a kid, 19 years old, was found unconscious in the hospital hallway and was initially brought in for dehydration and a high fever. We couldn't leave in the middle of surgery and had him transported to our hospital. As soon as he got there, did all the scans and exams and realized he had bled everywhere in his brain and was now brain dead. Bacterial meningitis was the final diagnosis and had to tell the family. I spoke Spanish, but I did not. Tried explaining to them that there was nothing we could do from this point forward. The family didn't understand and finally asked point blank, "Is he gonna die?" And I responded, "Yes." And they all started screaming. Worst position to be in. When family friends think you can do something to help their loved one. And despite all the training, sometimes it's impossible. It's a horrible feeling because you wish you could do something. I still think. Story 8. I work in physical therapy. We had a semi driver who had a spinal cord injury from a driving accident. His parents disowned him because he was gay and wouldn't help with his medical bills or let him stay at their house. He had lived out of his truck and was essentially homeless. We tried to keep him approved to stay in the hospital as long as possible, but eventually we had to tell him we couldn't keep him there anymore, and it broke everyone's heart. And because of his injuries, none of the homeless shelters could take him because they didn't have the facilities to accommodate him. I moved to a different unit shortly after, so I never found out what happened. Story 9. I had a patient whose newborn baby wasn't expected to live. The baby's condition was a surprise to the mother and her family. I got to sit in while the doctor tried to explain that the baby was doing very poorly. Mom and family remained quite optimistic. Fast forward to a few hours later, and the doctor returned to tell the patient in a shared room that her baby was doing very poorly and wasn't expected to make it. Doctor was frustrated that the very young mother wasn't reacting the way she wanted, told me that she was at the end of her bag of tricks, and was upset that mom wasn't responding to her sudden news. Granted, this poor girl just gave birth to a very medically unstable baby that she had no forewarning about. I ended up having to try to talk mom into seeing her baby, knowing basically nothing other than the prognosis was very poor. It was horrible all around. The way the doctor approached the situation, the way mom was too young and optimistic, "I'll see him later," trying to remain as neutral as possible while attending to 4 other mom-baby pairs that were happy as can be. I believe the baby ended up passing in the next couple days. It was incredibly sad. Story 10. I had a 21-year-old come in right around New Year's a few years ago. His serious girlfriend made him come in because he had lost a little bit of weight and was feeling tired. He told me that he works about 60, 70 hours a week and loved his job, but that he blamed his job for the fatigue. He wasn't sleeping well and complained of headaches nearly every day. This had been going on for the last 3 weeks. So I do it once over and immediately notice his spleen is about 3 times too big. When I asked him if he had noticed it, he mentioned that he had but didn't stop to think about it. I grab an US and some blood work. Ultrasound shows a 17 centimeter spleen. Normal is 11 centimeters. And at this point, I'm praying the kid has mono and is just having a major reaction. His white blood cell count came back at 680. Normal is 4 to 10. We rushed him to see an oncologist who promptly put him in the best hospital for cancer in our area. I later heard the oncologist put all her patients on hold for 3 to 4 hours while she answered all his questions and pulled some strings to get him the best care. I received a letter from his parents a month later. He was diagnosed with acute myelogenous leukemia and doing well. I'll never forget that kid. Story 11. Obligatory. Not a doc, but I'm in my residence. I was shadowing a doctor. I'll just call him doctor for privacy. For a week. We come up to a room with a child and his mother waiting. The doctor doesn't tell me anything about the situation, so I'm going in this blind. He goes in, tells the mother to come out in the hallway with. She comes with us into the hallway, and the doctor lets her know the child, 7 years old, has a pretty developed brain tumor and isn't likely to make it another 3 months. She dropped to the floor and started crying. It was heart-wrenching. I later asked the doctor why he didn't let me know what he was going to do. He said a big part about this career is learning what the impact of your words truly feel like. You may never be told you have 3 months to live, but if you can feel just a little bit of the shock, horror, and pain your words inflict on someone, it will truly make you a better doctor. Story 12, EMT here. About 5 years ago, I transported a patient to a doctor's appointment. This guy was paralyzed from the waist down after being stabbed in prison. He was looking forward to beginning physical therapy to start walking again. This dude looked like the stereotypical scary gang member, but he was actually a super nice dude who was really just glad to be out of that life. The whole drive in the ambulance, he was telling me about looking forward to running around with his grandkids, going on quiet walks with his wife. I guess he spent a fair amount of time in prison and wasn't there for his family, and he wanted to make it up to them as soon as he was able to stop living in a convalescent home and crapping through a tube. Once we got him to his doctor, he excitedly told the doc about his aspirations of a normal life. The doctor immediately and very tactlessly responded with, "Who told you that you'd be able to walk? That is never going to happen. You're going to be like this the rest of your life." My partner and my jaw hit the ground at the way this doctor delivered that news. Our patient pretty much shut up after that while the doctor was in the room. We thought he was going to go ballistic on the doctor. As soon as we left and got back into the ambulance, this guy who looked like he'd cut your heart out if you crossed him broke down into the most heart-wrenching cries I've heard to find out that his future was sealed and he would be a burden on his family. Just hit this poor guy. I really wish he was one of our regular patients. I would have liked to know how he's doing. Story 13. The late Mr. B was from my very small hometown, 2 years my junior in school, medical school, and career. I was a resident in psychiatry as Mr. B began his internship. One morning, a radiology resident called me and asked if I could come over to him immediately. I was puzzled, but agreed anyway. Mr. B had accompanied a certain indoor patient for an ultrasound exam. Afterwards, he jokingly asked the resident to pass the probe over his tummy. He wanted to view his internal organ. Resident could not believe what he was seeing. He called a senior resident, and then they called a consultant. All the while, they never ever dropped a hint to Mr. B that there was something wrong. Now they wanted me to break the bad news to him. They suspected that he was having an advanced stage of lymphoma. It was hard for me to break the news. He was not a patient as I saw him, rather like my younger brother and someone who I had known since my childhood. B could not make it. Story 14. I'm a nurse too. When I was a student and having practice in a hospital, I remember one patient. She was a woman, maybe 50 to 60 years old. And we were having an afternoon check with all of the doctors, surgeons, and nurses, students too, in the patient's room. So we were standing there, maybe 15 persons of hospital staff. That woman asked very quietly about her diagnosis because she was after some surgery but didn't know anything about the result. And the major surgeon literally yelled at her, "You have cancer. You didn't know?" It was one of the most terrible moments in my life as a nurse. We all, except that rude a-hole, felt terrible for her. She burst into tears, and it was heartbreaking being witness to such a thing. Sorry for my English. Not my native language. Story 15, I'm not a doctor, but a friend is. I remember him telling me about one of his clients. The boy was 16, and in Ireland, he just finished his junior cert. He was so happy about it that he organized a massive party for it. However, he felt very sick and was admitted into the hospital where my friend was his doctor. Now, usually doctors don't hang around patients that much, but the boy was so talkative whenever they were doing a checkup, he would talk my friend's ear off. But he was a nice lad. He stayed in hospital for a week, and finally they brought him in for a scan. Testicular cancer. My friend described the horror on the boy's face when the diagnosis was revealed. His father, who was a single father and an absolute giant, covered his face and muttered angrily. The situation seemed hopeless, but the boy survived. Last my friend heard of him, he was fine. Story 16. Not a doctor, but a family member. My cousin had bipolar, and even after several years, doctors were still struggling to find the correct medications and dosages to help her manage it. One day, she starts getting a rash. After a few days, the rash has spread. Her parents took her to the hospital. They run a bunch of tests, all of which show that nothing's wrong. A week later, her liver fails. Turns out that one of the side effects of her bipolar medication gave her something called DRESS syndrome, which typically has a super high survival rate. But somehow, her results for DRESS came back negative, so they didn't know that it needed to be treated. They were going to put her on a transplant list, but she deteriorated within hours and was too sick. She would die if they attempted the transplant. She died within 36 hours of the diagnosis. Worst week of my entire life. She was only 27. Story 17. Disclaimer. On the receiving end, not me, but my grandmother. I want to thank doctors, personnel that go through this on a regular basis. It seems like it never gets easier. My family was camping outside the ICU for the last 72 hours or so, while my grandmother's condition was quickly deteriorating. We were preparing for the worst during that time. People also flew in from other countries as fast as they could. It was very sudden. Literally, just as the last family member arrived at the hospital to see her, the young doctor that was caring for her gathered the family to announce that there was nothing else they could do for her. We all cried quietly, but it wasn't unexpected. We were crying on-off for the past few days. I could tell that the young doctor was just as heartbroken as we were. His eyes were glassy and slightly red. It must have been hard on him. She passed an hour or two later with all of us by her side. Story 18, I went through it as an onlooker with my mother this summer as she received a terminal cancer diagnosis. In September, she was in a hospice, and the doctor sat beside her bed, me and my husband on the other side, and he told her gently, but also to the point that she may well die in a few days, and at most a few weeks. He was very gentle in his approach, very calming, but also he didn't beat around the bush and just said it exactly how it was. He made time for questions, both from me and from her. He explained as best as he could how things would look going forward, what they could do for her, for me, etc. We were well informed, and so was she. Overall, we had very good experiences with all the staff, who really all had the same gentle but direct approach. I'm glad because my mom and me never got false hope that things would be okay, that she would get better somehow. It was just a mistake. It helped me, especially, I think, accept that it was going to happen and I couldn't change it. I was able to bypass the anger stage of grief a little. She died 4 days later on September 17th. Story 19. My husband got leukemia at 26, went through 5 rounds of chemo, and a bone marrow transplant. His body rejected the transplant and had to stay at the hospital. After 4 weeks of what felt like just waiting for things to somehow get better, I pulled the attending doctor aside to ask what the plan was. We were sitting out in a waiting area, and she put her head in her hands. While she told me he wasn't going to make it, she couldn't even look at me, let alone tell my husband he was going to die. She basically put all the pressure on me to tell him he was going to die. I had to go back in the room alone and tell him. I'll never forget that moment I told him. The fear in his eyes will haunt me forever. What made it even worse was my extreme panic set in. The whole cancer thing really created this, but I now throw up uncontrollably when I get super anxious. I threw up 5 times in 20 minutes after I told him. My nausea was so bad I had to drive home and get my emergency nausea med, as the hospital couldn't help me. So I had to leave him and drive 2 hours round trip, about 30 minutes after I told him he was going to die. The whole thing was extremely traumatic. The only blessing was that I was able to take him home for a little over a week. He hated the hospital and just wanted to go home and be with me. I took good care of him till he died in my arms. Story 20. I personally prefer when medical staff are direct and blunt with me. Years ago, my dad was hit and killed in a motorcycle accident. Young woman was lost and pulled a U-turn without looking. He hit her going 50, flew 26 feet. I called and ended up talking to this nurse that was just bullcrapping me about him getting better. No, Stacy, he has significant brain damage and will not get better. I ended up demanding the doctor who gave it to me straight. Odds, quality of life, brain function, etc. This data helped me make the decision to end life support because he would not have wanted to live in a wheelchair drooling. Story 21. I'm emergency medicine, so it is not often that I tell a patient directly that their condition will kill them, but I find evidence of advanced and terrible cancer fairly regular. I typically explain that while this is not a definitive diagnosis, the labs and imaging and physical exam, whichever is relevant, is very concerning for cancer. If they do not have symptoms that are life-threatening at that time and require admission to the hospital, I emphasize that they need to follow up as soon as possible with their primary care doctor and get a referral to an oncologist and/or surgeon. I have messaged primary care doctors in our system and called specialists to get people expedited follow-up for them. I have stayed late talking to multiple family members about the same thing. I involve social work to help get patients insurance. I cannot fix the healthcare system, but I do what I can from where I am. For patients that died or that we are actively coding or that will die imminently, I speak in plain terms and as directly as possible, with space for family to absorb these things and ask questions. It is important to get to dead or alive status quickly if it was a traumatic or cardiac arrest situation. If they died, you use the word dead or died. Anything else leaves room for distraught family members to misunderstand. Same with mothers and very clear miscarriages. Use the word. Also good to prepare people with certain medical terms as well. In this case, you should warn pregnant mothers who had bleeding but have a fetal heartbeat that the words threatened abortion will appear as a diagnosis and what that means.